So Dr. Martin, talk a little bit about what we can do to treat the dreaded cellulite.
Cellulite. 80% of all women have cellulite. It's a scourge on the female society. It's a terrible problem, and there's not a lot of answers. One of the things I do is Cellulaze, which is a cellulite treatment. It works underneath the skin. There's multiple products out right now. There's Cellfina, which is a radio frequency device. There is Phaser Smooth, which uses ultrasound technology. I personally like the Cellulaze the best. The great thing about this device and what we do with it, we do it in the office with you actually totally awake. You come in, you lay down, we numb the area up that we're going to treat. It takes about an hour. You walk in, you walk out. Amy, what are some of the limitations on cellulite treatments in general?
In general, you're limited a lot by the anatomy of the area.
Right.
And gravity.
Right.
The evil gravity.
Right. And any treatment you do, even best case scenario, like Cellulaze, which we do all the time, is going to give you about a 60 to 70% improvement. That's best case scenario. So it doesn't get rid of it completely, but it does make a huge difference. And I know a lot of patients that come in, they'll take 60 to 70% because that's a lot better than what they're currently living with. The reality, I think, for most people is it's going to last forever, but you're going to age. And when you age, the skin gets looser and some of these cellulite appearances come back. But it's going to last forever once those changes occur. Also, myself and people like me who are a little more advanced with this kind of stuff will do some fat transfer in the areas where the cellulite is along with the cellulite treatment and get a pretty nice result. In general, our patients are really, really happy with the results. We're very honest and upfront about that 60 to 70%. So at least from a result standpoint, our patients seem to be really pleased. What do you think?
I agree, and I think it's really important to talk to you about what are some of the things that people can do to maintain their results.
Yeah, so maintain your results. First thing, weight loss, exercise, healthy living, no smoking, avoid sun exposure, all these kind of things. The second thing is the cellulite is really a reality of estrogen. So estrogen effect on the skin and soft tissue, these really anatomic attachments that go from the muscle or that fascial layer up to the skin, they become hardened with time, and that has to do with the relationship of estrogen, how it causes swelling, and then you have less swelling and you have lack of blood supply in this area. So these hard attachments, these septae, these fibrous septae, what these treatments do, and they come and knock those off. Those septae are still there after the treatments. You can still have that process that works. You can still develop cellulite in the future. So it's impossible to stop that process. But if you go in there and divide those abnormal areas and maybe put some fat in there too, that will last forever. If you maintain your weight, stay healthy, focus on nutrition.
Boom. Cellulite's gone.
Cellulite's gone. One last thing. I think that for most women out there, cellulite is a real problem. And if you think about it, if you can go in there and make a 60 to 70% improvement and do some other things, maybe some liposuction in the areas of cellulite, really contour that lower extremity where most of the cellulite is, usually on the back of the thighs, the overall result is pretty dramatic. And that's what we do. We almost always do a combo case of a little bit of liposuction, maybe in those saddlebags area or the inner thighs or the knees, and treat the cellulite. All that together really, I think, in totality makes an amazing result.